Now I'm going to open up to questions that we had set up for you guys. So the very first question, and don't let me pick first, but basically just give a brief background on you guys' journey into medicine, any setbacks, successes, pitfalls that you guys are willing to share. And yeah.
So I have no problem starting. Hi, I'm Ronald, but I go by Ron. I'm a fourth year at PCOM. Well, I'm not going to reintroduce myself, but thank you all for being here. About my pathway into medical school and residency. I graduated from Florida A&M University, which is a HBCU, or historically Black college or university. There, I did a pre-med program that kind of was responsible for giving us the tools and the necessary guidance to get us into medical school. That was the goal, right? From there, that's where I first got, exposed to the different careers in medicine and what my career could actually look like, because at that point I didn't know. I just knew I wanted to be a doctor and I wanted to make it happen. So, studied really hard and had some struggles, particularly in my MCAT. I didn't do too well on that. And that was something that kind of held me back. I was really nervous to apply to medical school in the first place. I only applied to a few schools. I was just, had a lot of fear in my heart. But, some schools, took a chance on me. And I, at that point told myself that they wouldn't regret it. And I just, once I got into medical school, I definitely used that as momentum to kind of be better than I was, in undergrad, and just keep going and build on what my successes were before. And then going into residency, there was some imposter syndrome, going into radiology, competitive specialty, can I be that person, right? You're looking at the match rate, it's rough. I'm coming from a DO school. There are a lot of programs don't even want to touch DOs and IMGs. So that was, it's hard to overcome that stuff mentally, but, I just worried about my path and tried to just do everything I could to be competitive and also to meet good people along the way, and help me get to where I am today. So happy to say that I matched. It was hard, but we're here. So yeah.
Awesome.
I'll just go next, kind of piggybacking on Ron. So my name is Keisha, as Nicole introduced, and I'm an IMG, which is an international medical graduate. I don't know if you can tell by the accent, but I'm Jamaican, and I rep that country so hard. But I did medical school very similar to the British system, so I didn't have the chance, or I didn't have to do an undergrad degree. So I went straight into med school from high school, and it's a 5-year program, and I got 2 degrees out of it. And I did an internship and did some research subsequent to that. But I really got introduced to radiology when I was kid, I guess when I was 14, 15. My first summer job was at the Bustamante Hospital for Children in the radiology department there. And that's when I got introduced to the specialty and medicine in and of itself. And that's when I decided, I think medicine is what I'm going to do. But to apply to radiology, as Ron had kind of told us here, it's kind of difficult coming, him being a DO, me being an IMG. I've had people say, you can't do it. And, this is just the point where you say, watch me. And I'm glad to say that I was able to match, and I'll be going to Emory, and I'm very happy. So, yeah.
It's gonna be hard, like talking after these 2 great titans just talk, but I'll try to do something. So basically, my journey is pretty awkward in the sense that I wanted forensic sciences, and that's the reason why I went to college. But the way I saw it is I needed to do biology first. Met my best friends; they were intrigued with medicine. They kept me up all night studying for organic chemistry, for physics, and then I'm like, hey, I want to follow these guys' footsteps. And that's basically one of the things that drew me into medicine. That apart, that my Nana has Alzheimer's, and she always said like, oh, he's my doctor. He's taking care of me. He makes sure that I get everything I need and all my meds. So it was I was pushed by my Nana, let's put it that way. First time around, I didn't enter medical school. Second time around, I got a way higher MCAT. Probably, as Ms. Thomas can tell you, Dr. Thomas can tell you, problem with entering medical school in the States coming from a place that you're not native English speaker is a car segment. We do not analyze reading the same way that different cultures do. So that was like basically our step back. I was able to get into school here. I had offered to the state, decided to stay back home to stay with my family, and went through medical school in 4 years. I think one of the biggest setback was last year, and Dr. Bradshaw knows this. Dr. Naryan knows this. I went unmatched, and I will say, and I have no problem, I went unmatched with 18 ranks. So expect the unexpected. Always have a plan B, always move forward. And my plan B was internal medicine. So I went to a preliminary internal medicine. Something I noticed when I was doing my list this year, I don't like internal medicine as much as I have the passion for radiology. And people say, but why not? I'm like, I can't see people suffer that much. I can't deal with the family, seeing all the hardship they're going through, because I'm very emotional. So I get very attached to it. And I like teaching, and I like a system that you can see everything. So that's my reason for radiology. I was able to integrate my passion of teaching a lot, able to be a tutor in anatomy, be a lab tutor right now, and just help people move forward. That being said, don't give up hope, because this is the fun story here. The program I matched in, I was waitlisted. So I didn't hear that I had an interview with them until a month afterwards. I was waitlisted. So kind of like saying the step back, I've always had stepping stones, and I've always had to move forward. And if we all talk about our hardships here, we're going to be here for days, because everyone has them. It's just the way you conquer them and you move forward. And one thing I can say is, like, I'm here just because I had a lot of friends and a lot of people looking out for me and pushing me forward. And all the tips and advice that I got from this group here is just phenomenal. So take everything you get here with a grain of salt, but also add pepper to it, because it's going to taste good and it's going to make everything better.
Okay, I guess I'll go. So my name is Marcus. I'm originally from Atlanta, Georgia. I went to Morehouse for college, so predominantly HBCU, but all men. And then I transitioned to Duke for medical school. So that's the first time I went to a PWI in my life. So that's a little bit of a transition there in and of itself. And I say that because I know there are a lot of students out there who are doing the same thing for, medical school, and then they're looking at residencies, and there's no radiology residency at an HBCU so number one. But I had a lot of success in med school until match day 2003. And Fernando knows this, I did not match. Despite the fact that I did a year of research, I had presentations, I had all that jazz, I did not match. I then did nuclear medicine at Vanderbilt, met some wonderful people, reapplied, then did radiology at MUSC, worked there for 7 years. Now I'm back at Vanderbilt. And pleased to say that come July, I'll be a full professor. So I say all of that to say, as Fernando has said, there are setbacks, but despite it all, you can succeed. Your path may not be straight, but it does not limit what you can become.
Awesome.
All right, I guess I'll go next. Cam Henry. I guess this is me reintroducing myself. Wow. So Stanford undergrad and then University of Kentucky for med school. So I didn't necessarily have a bad match day, but I can say in terms of my match itself, I was undecided what I actually wanted to be in life. I was like deciding between emergency medicine and radiology. And one of the things that ended up actually cinching it for me was the mentorship. And I bring this up to say, no matter what stance you find yourself in on a match day, whether it's matching, not matching, or maybe not matching, especially you need to find mentorship in medicine, because it's how you go further and you go further faster. Because there's going to be people that have been through the exact same situation you may be going through, or might be indecisive about what to do next, who can definitely advise you. I say that to say, matching isn't the last thing you're going to have to do where you're going to have a qualm of what to do next, whether it be fellowship, what be the next job you take, how do you get promoted in your practice eventually. You're going to have to find people that have been there before so you can kind of make the best decision for you going forward. That being said, as it relates to going, let's say, unmatched on match day and having to participate in the SOAP, having strong mentorship matters. Everybody on this Zoom currently I know who's taking on mentees. So this is probably a good time to jot down some names and jot down some emails, because these are the people that are going to help advocate for you during a SOAP. And I could say myself, Dr. Bradshaw, alone this year, I think at least 5 to 10 people, we help find them either positions or rewrite personal statements in terms of, hey, edit that, edit this, and writing letters of rec for them on match day. So keep in mind, the world's not over. Your mentors are out there to see you to the next step, and they have your best interest in mind. And take rejection sometimes as redirection. It doesn't mean you're not ever meant to make it to that next step. It just means you have to take maybe a little bit more curving of a path.
Awesome. And Dr. May
Yeah,
Elizabi?
I guess that leaves me. Sorry. Hello, everyone. It's great to see you all, and it's amazing accomplishments to come after all of these great people. I think our common stories have been there are a lot of obstacles that you're going to go through to get where you are, and it's not going to end. And I completely agree. I think mentors are there to support you, to open doors for you, to endorse you, but also to tell you it's not the end of the world. One obstacle, it's just gonna, maybe delay you a little bit, but it won't stop you. And just even hearing a lot of others' stories, you'll realize that everybody has some hardships along the way, and you just have to persevere and continue. I did my medical education in Cairo, Egypt. That's where I am from originally. And as Kesha, the medical program there's no pre-med, so it's a 6 years program. I graduated from there. I did a radiology residency in Egypt, and then I came as an IMG here to the US. I did match the first time around, and it was devastating, as it is always. But I tried to find other pathways. I did do research for 2 years at the University of Wisconsin, and that was one way for me in. I'm ancient, much older. That was 20 years ago. So I did end up doing research for 2 years, and that was a way for the program to know me. And when I went through the residency, again, they accepted me as a resident. So I did repeated my residency at University of Wisconsin and then fellowship, and stayed on as faculty afterwards. And all of these steps, even though that we might say, it sounds like some successes there, but there are difficulties all along the path. And I think it's just realizing that there are a lot of people out there that are like us that continue, and there are going to be others that are going to support you and help you even when you're not expecting. And even if you don't find mentors immediately or come easily, seek them out. So definitely, I would agree, seek out the mentors, reach out to people. Maybe out of the 10 people you'll reach out to, one person is going to respond, and that person will be your support system.
Yeah, I love how everyone discussed the importance of mentorship. As a non-physician myself, I know having a mentor is also important, regardless of what your career path is. And it's important to seek out help and to get that extra perspective that maybe you're missing, and that can propel you along your career path. So it's an important aspect that everyone should look into. But one of the questions that students were having is, what are some things that applicants can improve in regards to their interview day? Anybody want to take a tag at that? Particularly the senior MDs on the panel?
I can say one thing that it's a little bit of a fine line. I think it's definitely every program is looking for applicants that are well-rounded and that have a lot of interest, but it's it's like I said, it's a fine line. You have to gauge that and always preface with, my education is going to be the most important thing. The clinical service and the clinical work and focusing on my training is going to be my top priority. I think sometimes I see that because applicants know that programs are looking for people with, interests outside of medicine specifically, to know that they have just a good outlook on life and a well-being sort of balance. But sometimes some applicants might take it a little bit step further, and that might be, unfortunately, in some situations might be taken negatively, as that this is a professional interview at the end of the day. Programs are looking for applicants that are going to be strong, that we're going to have strong work ethics, are going to be invested in their learning and their education. That's one point that I thought of.
Cool. I guess I'll go next on this. So the question being, like, what are programs looking for? Is that correct, Nicole?
Or yeah, what can applicants do to improve in regards to interview day?
Okay. In terms of what programs are looking for, I'll kind of address that first. I think every program wants to match residents that are eager to learn and kind of take responsibility for patients, especially in the radiology, since we're not necessarily in the room with the patient, but there's a lot of work to be done in the chart, finding relevant lab values, clinical information, prior scans that can make you appear that you know the patient inside out. And it's not like a passive learning environment where they're giving you everything. So saying that you're engaged, if you're on your away rotations, that you're inquisitive, that you're asking the next question, these are things that you want to do. Having interests outside of medicine, I think, is cool. I wouldn't necessarily fall into the cliche that some people mention that, hey, I'm a gamer or I'm into computers, so therefore I know radiology, or I'll be good at radiology. Because particularly with the gaming analogy, what you get into is people will wonder, well, are you spending your time at night studying, or are you gaming? That being said, ways you can kind of show that you want to go above and beyond, particularly for people doing aways in radiology, is, are you taking time after your rotations, maybe find interesting cases, write up interesting cases? Ron and myself actually did a write-up on peritoneal carcinomatosis when he visited us at Vandy. And why does that matter? I think that goes farther because, one, he was able to interface with another one of our attendings, Dr. Shearer, who actually became section chief. But you now have not only me as a resident being able to say great things about Ron, but you have another attending being able to say great things about Ron. And that can go a little bit further. So always be on that search for, what can I do to show I'm really engaged, I'm really interested in the subject matter. I think it's important.
I'm just gonna throw something on real quick. Things you can do better on that interview day. Do your homework, right? Like, all these programs have information on the internet. You should look that up. I know we say there are no dumb questions, but there are bad questions. Like, you come in, you ask how many residency you take a year, like, look at the picture, right? So there's certain things you can do to be prepared for that interview. Know why you want to go into radiology. It seems pretty simple, but every year somebody can't answer that question, why you want to go to that particular institution. And then I'm going to give you the non-political correct answer in terms of what I'm looking for. And I'm looking for people that's going to grind and going to do their job. Because if we're being honest, if you come to Vanderbilt and you don't do well, who are they going to call? Who are they going to talk to? They're going to come to me and say, well, can you go talk to such and such? And so I want people that are hardworking, that are self-starters, that I know if they come here, they're going to do their part, because if they're doing their part, I can make sure that they're going to be successful.
Awesome. Yeah, hard work is very important in the field of medicine, for sure. So another question that that we have for you all is what qualities in a candidate let you know that they're a good fit for radiology? And I know Dr. Henry and Dr. Marcus Bradshaw, you guys just touch up on this, but if anybody else wants to take a stab at this as well, that'll be great. Dr. May Elizabi, I know you're part of the selection committee as well, so.
Yes,
Get some
I
good
would say,
insight.
I think in radiology, it's you are part of a bigger team. So understanding that you are going to be a team player, understanding that you are going to be in a program where you have to support your colleagues. There are work lists that everybody needs to contribute to. There's handoffs for patients. So any examples, and I think a lot of programs on the interview day will ask, well, what are some of examples of your clinical experiences? Highlight experiences where you were a team player, where you were able to support your colleagues, you were there to get the work done. I agree with Dr. Bradshaw. I think all programs want to make sure that whoever joins their group is going to be a hard worker, as is going to be engaged and doing the work.
Great. And then, so the next question, and this is going to be the last question primarily.
Nicole, I think Fernando had his hand up.
Fernando?
Yeah, it's real quick because I'm not part of selection committee, but touching on what Dr. Elizabi touched, one of the questions that were asked around multiple of my interviews were basically, tell me a memorable moment in medicine. That's actually not a trick question. It's just to see what you think is important. And what Dr. Elizabi was saying, they want you to answer basically, show me when you helped. Show me when you moved forward. Show me when you moved and you did something with initiative. Because that's what's going to tell me, like, this person is not the one that's going to wait at 4 p.m. to leave when maybe a colleague or maybe an attending is really backed up with work and could benefit from reading 2 more films from a list of like 5. And it's not going to say like, hey, there's 5 left, I'm going to leave, I got to go home. Well, most likely your attending or your colleague might have been doing research or something, or working with a medical student helping. So it's a question that it's a double-edged sword, and know how to answer it, because that's gonna do you or it's gonna break you. And I learned that the hard way. So you gotta move forward with that.
Thanks for that. And last questions, and this is primarily for the MDs as well, and this is kind of to give advice to our incoming residents. Congratulations to you all again. What are some things, well, how did you balance the demands of residency? Just to give a good tip and heads up for our incoming residents, Keisha, Thomas, Ronald, and Fernando. How would you all prep them for what's to come?
So I'll start off here. Try to find a good support system. So that can be your residency class as it comes. I can say at Vanderbilt alone, we've had at least 4 or 5 babies out of the last 2 or 3 classes. So there's going to be times where people are taking off for paternity leave, paternity leave. There's been deaths in the family that you're going to have to leave from. So try to make friends as best you can, because these are going to be the people filling in for you when you're not able to be there. That being said, really commit yourself during residency to learning radiology. There's not a lot of time outside of radiology to truly have that other life you want to have. Like, this isn't necessarily the promised land you've been promised in med school. Residency is a tough time. There's a lot of reading to get done, and it goes by very quickly. I graduate residency at the end of June, and I can tell you there's some areas where I still feel like, wow, I hope there's a bigger fellow or bigger attending than myself to answer a question like this if I were to get it. That's not saying I don't have competencies in all the areas I need to, but radiology is tough. So when I mean always be reading, how the rubber hits the road with that reading is, once you get in there, there's going to be your in-service exam that you're going to have every January. There's also going to be possibly RAD exams. It's kind of like a monthly quiz type thing that you might encounter. And you got to ace those things, because you don't want to slack off with them thinking the only thing you need to pass is core, because it is possible to get held behind a class in residency or have certain privileges as a resident revoked if you don't do well on things. And you want to set the right, you want to have your best foot forward starting out. You don't want to give people the wrong idea, like we let you in just for you to not work, if that makes sense, or just for you not to study.
And May or Dr. Bradshaw, just have one of you guys go, and then we can move on to the questions that we have from the audience.
All right, so I'm old school. So I don't think there's any substitute for actually reading. So I would advise that, you know, you set a schedule for yourself, read an hour or two every day. If you have a time where you can't do it because things come up, life happens, that's fine, but make up for it on a different day. I will tell you as an attending, the only thing we know about you is what you show us, right? And so I try to encourage the residents, particularly the first years, you hear, you know, first impressions, you should beat your attending into work, right? Like, I get paid for do this, you're here to learn. You should come in early. If you're on a rotation where, you know you're going to be responsible for the chest x-rays, then why not come in early, start reading those chest x-rays and show the attendings that, you know, you really want to be great at this. Because if you put the effort into it and your attendings know that you're putting in effort at home, then you'll be amazed at how much teaching you'll get during the day. But if your attending gets the impression that you're just trying to slack and you're just trying to get through the day, because let's be honest, eventually somebody's going to tell you what to say, then they're not going to waste time teaching you if you're not really invested and engaged in what's going on. So put the effort into it. You said you wanted to do this. You have 4 or 5 years to learn this material and learn it well. And so put the effort in and you'll be where you want to be on the back end.
Awesome. And Dr. May, I don't know if you want to have something really quick to add, or
I have one really quick thing, a follow up on your cases. So if you're doing reports, staffing out, follow up on the outcomes for these cases. They're always very informative. You always learn something from every case that you've read. If you do staff outs and you get to see what the reports and the edits that were done after you've read with your staff, I think that's very helpful because it gives you a good understanding of what the nuances of the reporting that you need to include. I think it's always very helpful. I've always saved like the last hour, even if staying a little bit later after work, reading through the reports and seeing what the edits were. I think that's one way to learn pretty fast.
Awesome. All right, and so this next portion, we're going to transition into questions that the audience members might have. You guys can either drop them in a chat and I'll take a look at them, but we do have pre-curated questions already on hand. But if you just want to raise your hand and we'll allow you to speak and ask questions from the panelists. And I'm pretty sure since most people are medical students, they want to hear more from the match 2020-23 match students. And yeah, but we can open it up to all panelists. So I'm just going through them. So the first question is, any tips on personal statements? And I'm pretty sure this is directed towards those who've previously matched. And you guys have any?
Your personal statement
Yes.
shouldn't be more than a page. I like to kind of harp on this. You don't know where you're going to fall in terms of the app. Are you going to be the very first app that's opened out of 1,000? Or are you going to be the very last one? So you really need to catch people's attention within that first paragraph. And not going over a page, you should really be able to say your story in that, because it's very unlikely we're going to read past it, especially if it's maybe long or convoluted. That being said, you have to explain why radiology and why you would be a good resident and what we can see from you as a resident if we were to let you into a program, or just especially radiology. Try not to be generic. Everyone's going to have the experience of saying, oh, I've been in a hospital, I've seen somebody with a certain condition, which really have to tie to you, tie to what you want to do in the future, and really kind of build a story and a narrative. don't just kind of ramble off facts about yourself, but truly try to build a story, because you want to basically have people at the end of your personal statement saying, wow, I can't wait to meet that person because I want to ask them more questions. You're pulling them in with a statement. So that's kind of my biggest thing, some personal statements there. Also, in terms of red flags, if you didn't pass step or if you didn't pass the course, it's going to already be in other parts of your application. They will know about it. So spending multiple times harping on it in your personal statement without saying necessarily what you learned or how you're gotten better over an adversity can hurt you. There was a statement I was looking at this year where someone had a great statement, and then they mentioned in the very last paragraph that they were crestfallen when they failed step and they did bad on a course. And they left it at that. So I'm left at the end of their statement with this sour taste in my mouth. I don't know what they've learned. All I know is you give me a big red flag at the very end of that personal statement.
I was just hopping into like kind of talk about that 1-page thing, because that was a struggle for me, and it's going to be a struggle. But something that's actually very important, a tidbit to say, is that 1 page on Microsoft Word is not equal to 1 page on ERAS. And that is something that I wish I knew a few weeks before, but essentially just make sure that you're always putting your personal statement in the ERAS system and seeing how it presents on ERAS, because 1 page is actually a page and almost a paragraph in ERAS. So that's something that needs to be taken into consideration as well from yeah. I don't know how they read it or anything like that, but that's one thing that's very important. But they're serious about that 1 page thing. It's a lot that they go through, you know.
And can I add, I would say definitely speak about who you are. I think the generic, I like radiology because I like solving puzzles, does not tell people who you are. When the programs are reviewing 900 applications, they want to know who you are. So something about your personal story, why you're here. And I would say the supplemental process that they've instituted this year is also a good place to include hardships or struggles, or how you overcame failing your first attempt at step 1, or getting the bad evaluations on your first rotation. That's also another place where you can explain some of the drawbacks or setbacks that you might have had in your pathway.
We have another question from the chat. It's from Talal Murad. He said, thank you all for your time. What advice do you have for a reapplicant starting a preliminary year, TY this year? And I know, Fernando, I think you touched on this a little bit. Do you want to take a stab at this question?
So I was actually answering right now, so I'm just going to read part of it. Now keep going. So basically, I'm going to read a quote unquote like, hey, I would recommend trying to talk to your chief residents / attendings and schedule easy rotations. Like easy rotations would be like outpatient clinics, your electives, because you could do an elective in something that's calm and passive, and even emergency room. Like you'll have 40-hour weekdays, basically, when weekends included, on a 7-day basis. You'll have 3 days off, give or take. So you're able to do research, you're able to do publications. Try to take as much advantage as you can of that little time, because you don't have a lot of time. You have maybe 3 months, 2 months before the ERAS application deadline to all the programs open it up. Now, when it comes to interview parts, I would recommend talking ahead of time, like saying, hey, I'm reapplying, these are my goals, this is what I'm looking for. I'm expecting, say, 10 or 15 interviews for this year. So I'll be asking you at least with 4-week anticipation. Like you need to try to be very tactical with this, because there are programs that will have no problem helping you out. And I've had friends that basically they're like, hey, you got to go work, you do your interview, and then you come back to work. It can get very chaotic on your interview. The other part would be try to take it easy. It's an intern year. Something Dr. Bradshaw told me. It's hard. You need to be obviously on top of your game. You need to study. Don't believe because you're going into radiology, you don't need to study about internal medicine or surgery. These are people's lives on your hands right now. So you need to be as the best doctor as you can be, because you're not a medical student anymore. You're a doctor. You have responsibilities. So try to take advantage of that time to learn as much as you can, because you will also use this in radiology residency. But in terms of trying to, or reapplying, try to take those 3 early months to do as many projects as you can, reach out and be as productive as you can those 3 months, basically.
Awesome. Anybody else have anything to add to that as well?
Yeah, and I will add a little nuance to Fernando's comment, which I think it's great. I would say when you are reapplying, programs are going to see really and look towards the letters of recommendations from the program that you're in right now. So it's a fine balance. You want to be able to achieve a lot, do some radiology research, but also your performance in the first few months that in that transitional year or internship will be very helpful if you get a good letter of recommendation from that program director. That's going to be, so think of it, that's going to be the addition to your application and what people are going to see during the interview. So I would say definitely be proactive, be present, be a hard worker, try to be engaged, let them know you, because a strong letter of recommendation from the program and that you're in right now is going to be a great advocate for you.
All right. And the next question that we have in the chat, let's see. Any tips for incoming research fellows, how to make most of your research years? And I know, Keisha, you work at Emory University doing research. So any tips for this person?
Yeah, definitely. So a misconception that I guess is like, okay, I'm a research fellow. The goal is to get 5 million pubs, and that is like maybe like the secondary goal. I think the main goal is to show these people that you can work. When you have the opportunity to work with people who are ultimately probably going to be writing an LOR for you, you need to ultimately do the work. Just focus on that. Networking with different people in the department is also a really good idea. And once you do those 2 things, the publications are going to come. I only have one, and I've been doing this research thing for a while, but I think the connections that you make, the people understanding your work ethic is more important than that. So like the simple advice is do your work, good turnaround times, take initiative, don't let any projects lag behind, because that's not nice.
And we have another question in the chat from Antoni Bonner. Excuse me. What kind of exposure to radiology do you think is necessary or helpful prior to applying for radiology residency program?
I can answer this just from my perspective and things that I tried to do to make myself more competitive. I think especially if you don't, we're gonna get to those questions about not having a home institution, being a DO, all of these things too. But the exposure portion, I think case reports are a great place to start, especially, if you're looking at a short timeline. It's about March. 6 more months is plenty of time, but it's not something that you want to wait on, because for example, with my application cycle, about this time last year, I started reaching out to different individuals just from, top, research institutions in my region, just to figure out if there was anyone who, needed help on a project. So shoot your shot, right? If you need mentorship, ask for it. If you're looking for a case report, ask for it, and don't be shy about it. I think it's just really important. Even in that first introduction email, I'm looking to get published. I'm looking for research opportunities, and closed mouths definitely don't get fed. So I would, again, like Dr. Bradshaw said, You can look on websites and see, okay, this person's a VP of the research department of radiology. That would be someone you should contact, because I got, these people will help you. People, have been in our shoes before as an applicant, and they respect the initiative of someone who is looking to be better than they were and work hard. So I would just say, be relentless about finding people who are in the position that you want to be and talking to those people. So case reports, whether it's, you go on a rotation and figure out what projects are going on. The research, of course, is the main thing that people look for. But also mentorship is very valuable as well, because they will put you in, they will give you information that is not so readily available, I would say. So there's I know Dr. May, she had spoke about some opportunities from the AUR, which is a radiology society. There are plenty of different platforms where, people are in the radiology community, they're calling us to action, applicants, to help out with different projects. So I just say really lean on these people. Med Twitter is great, and you can get the information you need. So lean on everyone in radiology.
I second the Med Twitter. Very always slide into people's DMs, slide. I've gotten a lot of blue ticks, and just shouting out Dr. Bradshaw being the first person who actually read and responded and met with me on a call, and really set me up for success. So really appreciate that. But definitely reach out to who you can reach out. There are going to be people who are going to blue tick you. There are going to be people who are going to say no, and you just brush that off and move on, because it's going to happen.
To second that, one thing that I did, I would follow people on Med Twitter, and if there was any radiologist who followed me back and I felt like I identified with in any way, or even if I didn't, completely different background, color of my skin, whatever it was, if you follow me back, I would reach out, just because, you got to meet these people, and that's really the way to get where you want to get to and get the information that you need. So do not be scared. Fear will block you harder than anything else will. So you just gotta meet people.
And just to piggyback back on that, there exists multiple conferences, radiology conferences throughout the year. And if there's one close by, if there's one that's a cheap flight away, I'd suggest go there, because meeting people in person is definitely 10 times better than meeting them on Twitter. But that's definitely a thing that you can look into as well in terms of radiology exposure to who asked that question. And as Marcus just put in the chat, join the ACR, RSNA, and get on some committees. And that's great advice to indicate your interest in radiology as well as networking.
To put the mic back on you, Ronald. This next person has a question. What advice do you have for DO students? I know you went to a DO school and you kind of touched on it already. But any other advice that you would give to that person? This is asked by Raymond Crowthers.
Oh, for sure. I think, coming from a DO school, a lot of times, just based on what you're told, based on the way MD students look at you, based on the way the community speaks about DOs in general, you can fall into that trap of feeling, lesser than. So I think that the very first thing that you have to tackle is what you believe about yourself. And, if you look at your school as a hindrance, it will be. If you look at your own merit as if you look at yourself, right, and you're happy with who you are, you're happy with we all know that DOs get trained in a great way and are going to be qualified to do the work. So you can't let anyone or any kind of, situation make you feel less than that. So it's really important to first just get it right in your own head that you are, adequate, right? And then, a lot of DO programs don't have a particular hospital associated with them. So you might not have a robust radiology program. But I think that's why it's important to just go outside, reach beyond your program if that's your situation, because you can meet people from all the institutions that you may aspire to be at, and and someone will help you, right? Someone will talk to you, give you the advice you need. And if you just you put it on paper, right? One of my mentors told me this, whatever you put on paper will be the truth, So, whatever school you go to, it doesn't matter if you did the work to get, let's say whatever score you wanted or whatever, research opportunity you wanted. It really is up to you, and your school won't decide your merit. It'll be your own choices. And so I would say the first step is to win the battle kind of within in your own head, and block out the noise, and it'll work out just fine for you.
Awesome. And some of the questions were answered in the chat. Ranesh Budai, she asks, which is better, USCE versus observatorships for DR match? And Marcus Brashaw replied, I think they are going to be treated the same. For me, the key would be for you to get a letter of recommendation out of the experience. Dr. Marcus Brashaw, you want to expand upon that a little bit more?
Yeah, I just know for IMGs, it can be difficult to get these clinical observerships. And sometimes they want to charge you an arm and a leg. So personally, for me, I try to go whichever would be the easiest one for you to get. But I think it's imperative, that's been said multiple times, that when you get there, you want to show the type of person you are, what your work ethic is, so that that person feels comfortable writing you a strong letter of recommendation so that you actually get something out of that experience.
Oh, if I can also tag on to that, all research opportunities are not created equal. If you know you have to either apply or reapply, let's say in September, and you don't have research, don't find a project that you know you're not going to be able to either publish, submit, or get a publication out of within that time period. Like, for example, if someone says, hey, there's a book chapter I want your help writing, you can't get that done before September, and it's definitely not going to get published before September when apps go in. So that's not necessarily going to help you in your app the way you think it might. You do have to balance this with, okay, if the person's asking you to write it and they're going to write a very strong letter of rec for you and they have a position of power within that department, that can be a complicating factor. But by and large, if you don't have research, you got to find things that are going to be able to get published or at least accepted for publication or presentation within that period of time. So look for your case reports, look for your case in points, abstracts, particularly if you guys are looking for abstracts coming up. RSNA has a abstract deadline, I think, of May 3rd, and they let people know midsummer. And that's a perfect way to say, hey, I have an abstract and I'll be presenting at the largest conference of radiologists in North America coming up. Does that make sense?
Yeah, definitely. And another thing to just piggyback on in terms of the US clinical experiences versus an observership. As an IMG, yes, there are going to be a bunch of people saying, oh yeah, 3,000 US, 4,000 US for like a week at some place, XYZ. Once again, the networking thing is very, very, very great. But even before the networking thing, something that I didn't know until I graduated and everything, if there are any IMGs who are, or not necessarily the G part, but international medical students, there are a lot of opportunities for you to do free observerships as a student. But once you graduate, it does become a bit difficult, and you would have to have somebody support you in getting an observership at their institution. That I would recommend not to pay for it. It's usually not worth it.
And I want to highlight things that Dr. Narayan included here in the chat is also the different medical student committees at the national societies. I think those are great opportunities to network. RSNA, ACR, I think those are great opportunities, and Dr. Narayan included some of the links for the membership for medical students. I think that's a great opportunity.
Awesome. So we do have 3 more minutes left in the panel. There was one question that I got sent via email that I wanted to ask you guys, and I think it's a good way to end this panel discussion. And they asked, what are you guys most excited about entering in your radiology residency program? And we can also ask to the senior MDs, what it is about radiology that you guys love the most? Anybody want to take a stab at it?
Yeah, I could start. One of the things I'm most excited about going to Vanderbilt, I was fortunate enough to do a rotation there. And I think the people were very, very welcoming, very kind, and also very forward thinking. And those were things that I valued. I didn't go into it, just like, okay, begging, like, okay, I really want to be here. And that's what it is. It's like, I'm trying to join what you all are already doing and add value to it. Right. So I think I'm excited to be somewhere that is passionate about, I guess, more than just reading studies. And I think that this is a great opportunity to kind of put it on you all's radar to find that thing in the program that you want, that you feel like will make you feel valued and make you feel important. And those things are the things that you can carry on and be excited about rather than just becoming a radiologist,
Keisha?
Yeah, even regardless of the program, I'm excited about the move. Leaving home, it's a big thing for IMGs. These are like the minor things, but are sort of major to me. Just the whole different weather, getting used to degrees less than 70, kind of wild. But in terms of the program, I'm just really excited to be surrounded by a group of like-minded, driven individuals who I've had the opportunity to work with, who I'm currently working with right now, and seem very happy with where they are, very excited about their jobs at Emory, and I look forward to joining them and playing my part in advancing radiology as a specialty there and, hopefully internationally.
Thank you, Dr. Marcus Bradshaw, for attending. And thank you for that, Keisha.
No problem, Nicole.
And then I'll say one last thing, what I'm excited about, I think there is definitely a change in the culture, in the landscape of radiology. It does still remain a competitive residency, but I think for the great work that a lot of the leaders in radiology that are doing, it's opening up more to IMGs, to DOs, to appreciating every skills that we all bring to the table. So I think that's something that I'm really excited about. And I think even the match results so far, the preliminary results, increase in the IMG applicants in and matching and DO matching. I think it's definitely moving in the right direction, and I'm excited for the new landscape.
And Fernando and Cameron, you guys have anything to add to that?
Fernando had to hop off.
Oh, Fernando.
Yeah. The only thing I'll add is radiology as a field keeps on growing. And I'm not talking about just in terms of technologies, but also the diversity in it. And I'm excited to see where we're at in 5 to 10 years as we continue to kind of build this pipeline. It was great speaking to all you guys tonight. If anyone has any questions, my email is cameron.henry@VUMC. Hit me.
Awesome. All right. Thank you guys for attending.
I put my email in the chat if anybody needs to reach out to me.
Okay.
Yeah.
Awesome. Yes. And if you guys want to put your emails in the chat, just drop them down here. And thank you everyone for attending the post-match panel series. Glad to have you all, and we'll see you guys for the next session as well. And if you guys have any questions, you guys can email me at ndboone@wisc.edu. And we will be sending out a survey for you guys to fill out, and we'll try to see what we can do for the next session. All right. Thank you all for joining, and hope you have a good night.
Thank you, Nicole, for running a great session.
Thank you so much.
Absolutely.
Thank you, guys.
Thank you, Nicole.
Thank you.
Thank you.
I'm gonna stop it.